First, I'd like to welcome you all to this presentation about talking with your doctor. My name is Ford Simmons, Reference and Information Services Coordinator at the Sumter County Library. Today we'll learn about how you can take an interactive role in your health care. Please note I am not a doctor and do not have the medical expertise to address individual health concerns or provide medical advice. This information in the presentation comes from the National Institute on Aging, a federal agency that is part of the National Institutes of Health and the Department of Health and Human Services. You can visit www.nia.nih.gov for more information. In the past, the patient-doctor relationship was one-directional. The doctor typically took the lead and the patient followed. Today, a good patient-doctor relationship is a partnership. As an active member of your healthcare team, you should ask questions. If you don't understand something, ask your doctor to explain it again. Your doctor may use technical terms and not realize they are unfamiliar or confusing to you unless you say something. You should also speak up. Tell your doctor if something is bothering you, such as a pain in your hip or other symptoms. Don't just wait to see if it goes away. Or you can let your doctor know if you're unsure about that surgery and want to hear about other treatment options. Taking an active role in your care puts the responsibility for good communication on both you and your doctor. Today, we'll help make it easier to ask questions and speak up by talking about how to get ready for an appointment, share information, and making decisions with your doctor. For this activity, you're going to write down everything you ate and drank yesterday, including about how much of each item. Take a moment to do this activity, hit the pause button, and when you're ready to resume, hit play again. So, how easy was it to remember everything? Did you realize that you forgot at least one thing while writing things down? Maybe a piece of candy or the glass of water you drank with your pills? It can be hard to remember every detail like that. It's the same at the doctor's office when you have to remember every health issue you've had, concerns, what medications you take and their dosages, what over-the-counter drugs, vitamins, and supplements you use. You might feel pressure to fit everything in under the short time you have with a doctor. It's easy to see how you might overlook something important. There are things you can do to prepare for an appointment so that you have a clear idea of what you want to accomplish and don't forget something important. Most of the tips we'll talk about are for regularly scheduled doctor's appointments rather than for the emergency visits. So, you start by listing everything you want to discuss. If you have a new symptom or problem, make notes about how long the symptom lasts, what makes it better or worse, how it affects your daily activities. If possible, start this list a week before the appointment so you have time to add issues you may have forgotten at first. Prioritize your list of concerns and highlight the 3 to 4 most important to discuss first so that you don't run out of time to bring them up. Make note of other health and life changes since your last visit, such as new illnesses, operations, or medical conditions, emergency room visits, changes in appetite, weight, sleep, or energy level, changes in medications or reactions to medications, a recent loss or move. You may also ask your doctor's office for the medical history form before your visit, so you have extra time to fill out the new information. Take the following information with you to the visit: names and phone numbers of any other doctors you see, even if you don't see them regularly, your insurance cards. If this is the first visit with your new doctor, bring medical records and additional files, charts, test results, or other information from your former doctor. Or have your new doctor's office contact your former doctor's office to get copies of your medical records. You'll need your old doctor's name and address. Also, bring a complete list of what you take along with dose information, or put all your pills, drops, vitamins, and herbal remedies or other supplements in a bag and bring them with you. It's possible for medicines to interact, sometimes causing dangerous side effects. That's why your doctor needs to know about all the medicines you take, including medicines prescribed by other doctors, and things you buy without a prescription, like headache medicine, eye drops, vitamins, laxatives, herbal remedies, and other supplements. If you experience side effects, do not stop taking your medication without talking to your doctor. So, part of preparation for a doctor's visit is pulling together your list. Another part is thinking about potential obstacles to communicating with your doctor. Wear your glasses and your hearing aids and let your doctor know if you have a hard time seeing or hearing. For instance, you can ask your doctor to speak slowly. Also, consider bringing a family member or friend so they can take notes. Also, ask your doctor for an interpreter if you need one. Explain your concerns to the interpreter before your appointment so he or she can fully understand your situation before telling the doctor. So, you prepare for your appointment by making a list of your concerns in order of their importance to you, writing down your medications, noting all the changes in your health since your last visit, wearing your glasses and hearing aids as needed, and maybe even practicing what you want to discuss with your doctor. Now you're ready to set your plan into action. Now let's do another activity. Look at this picture. If you had to guess, why do you think this woman is at the doctor's office? What do you think this woman is feeling? What might be her symptoms? Take a moment to think about it. Hit pause and then hit play when you're done. Did you find that you had different ways to describe the same picture? This is a lot like sharing the symptoms of a potential health problem with your doctor. Health issues like back pain or fatigue have different meanings to different people. By giving clear descriptions of your symptoms, you're helping your doctor figure out the root of the problem. When sharing information with your doctor, start from the top of your prioritized list of health concerns. Describe your symptoms in a clear and concise way to help your doctor diagnose the problem and decide what to do next. Examples might include pain, fever, lump or bump, unexplained weight loss or gain, feeling depressed or sad all the time, problem sleeping, or diarrhea. Share with your doctor what the symptoms are, when they started, how often you have them, what makes them better or worse, and how they affect your daily life. Don't assume your symptoms, like pain or fatigue, are just a normal part of aging. The doctor needs to know how you feel. After discussing your symptoms, go over your medications using the list you created or bag of medications you put together before your appointment. Let your doctor know if you've had any drug allergies or reactions. For example, did any medicine make you feel lightheaded, interrupt your sleep, or cause constipation? Make sure the doctor's office has the contact information for your pharmacy so that they can call in prescriptions. Try to use the same pharmacy for all your medicines prescribed by different doctors. The pharmacy tracks all this information and can notify you about possibly dangerous drug interactions. To provide the best care, your doctor must understand you as a person and know what your life is like. Your doctor may ask you questions about what you eat and drink, how you sleep, what activities you do, if you smoke or drink. Think of the doctor's office as a safe place to share information. It's best to tell your doctor the whole truth. Knowing your habits will help your doctor to understand your medical conditions fully and recommend the best treatment choices for you. Also share any other concerns. For instance, tell your doctor about any major changes or emotional stress in your life, like a move or a recent loss. You'll give your doctor a lot of information during your visit, but you'll also get a lot of information. Asking questions about this information is very important. Here's how a conversation with your doctor might go. Pay close attention to the last two items on this list. The conversation doesn't end after the diagnosis and treatment plan. Ask questions about the diagnosis, any words you don't understand, or instructions that are unclear. For example, if a doctor says something about an acute myocardial infarction, what would he or she mean? It's a technical term for a heart attack. What about if your doctor tells you to take medicine with food? Does that mean before, during, or after a meal? It depends, which is why it's important to ask plenty of questions. Next, we'll talk about questions to ask your doctor. Let's start with questions about medical tests. Sometimes doctors do blood tests, x-rays, or other procedures to find out what's wrong or to learn more about your medical condition. Some tests are done regularly to check for hidden medical problems, even if you don't have any symptoms. Before having a medical test, ask your doctor to explain why it's important, what it will show, and if insurance will cover the cost. If insurance isn't going to pay for it, you can ask who to talk to about the out-of-pocket cost. Some questions to ask your doctor before the test are: what will the test tell us? What does it involve? How should I get ready? Are there any dangers or side effects? Find out how or when you will get the results. Arrange with your doctor to have the results of the test explained to you, allowing time for questions. If the test is done by a specialist, have the results sent to your primary doctor. Next, let's consider questions about your diagnosis. A diagnosis is what your doctor determines to be your health problem. It's based on your symptoms and the results of your physical exam and other medical tests. After the doctor gives you a diagnosis, here are some questions to ask. Why do you think I have this diagnosis? What may have caused it? How long will it last? Is it permanent? How is it treated or managed? How will it affect me? Make sure you really understand your diagnosis and its implications. If you don't, have your doctor explain it again. Ignoring the diagnosis will not make it go away. Understanding your condition will help you make better decisions about treatment, and knowing what to expect may make it easier to deal with the condition. Have the doctor write down the name of the condition and any other relevant information for you. That way you can refer to it later and share it with others. Ask your doctor if he or she can recommend any resources to learn more about your condition. Have you ever noticed that when you tell your doctor something, he or she repeats it back to you to make sure he or she understood everything correctly? That's a great opportunity for you to correct your doctor if he or she has gotten something wrong. You can do the same thing when getting information from your doctor. After your doctor tells you something, like your diagnosis or treatment plan, repeat it back in your own words. Do you think that might be helpful? We have just a few more slides left. Sharing and receiving information are two important steps in doctor-patient communication. A third is to make decisions about your care together. Talk about treatment options. Ask your doctor about all the ways to treat your health problem. There may be more than one. Discuss the risks and benefits of each one. This includes possible side effects, that is, unwanted or unexpected symptoms of the treatment. Also ask about how likely a treatment might work for you and what exactly it will do, length of treatment and if you will need help from family or friends, or whether insurance will pay for the treatment. Have your doctor give you directions in writing. Think about how each treatment will affect your life and ability to do activities you enjoy. Share your concerns so your doctor can work with you to help develop a treatment plan that meets your needs. If a treatment makes you uncomfortable, ask if something else might work. If your treatment involves getting a prescription, make sure to know what to expect. You can find more specific questions about medications in the handout. Remember that a successful doctor-patient relationship is a partnership. To recap some highlights from our presentation today, as an active member of your healthcare team, you should prepare for your appointment by writing down a list of your concerns, share any changes in your medical history and a complete list of your medicines, make sure you understand what the doctor is telling you, and take notes to ask the doctor to write down information to help you remember. This brings me to the end of the presentation. I hope you found something particularly helpful and something surprising or something you hadn't thought about before. For additional information on talking with your doctor and other free resources from the National Institute on Aging, visit the website www.nia.nih.gov and click Publications on the top of the screen. There you can download or print your own copy of the Talking with Your Doctor booklet. If you don't want to go online, you can call the National Institute on Aging Information Center toll-free at 1-800-222-2225 to speak to an information specialist. Thank you.